Hello everyone, we are Group 9. We want to explain about tetanus, in Japanese, Hashofu. We would like to present three things. First of all, pathogens and symptoms. Next, mortality rate of tetanus. And finally, prevention and treatment. First, pathogens and symptoms. Pathogens is some microorganisms that can cause disease. The pathogens of tetanus is Clostridium tetani, Hashofukin in Japanese. When you have a scratch, Clostridium tetani enters your body from there and produce neurotoxin called tetanospasmin. Tetanospasmin is delivered to central nervous system, peripheral nervous system, sympathetic nervous system, and cause several symptoms. Initially, you will have a difficulty in opening your mouth, or your muscles will have tense. Progression of tetanus results in painful spasm or breathing difficulties. Second, I want to talk about mortality rate. So, what is it? We have to distinguish two similar words, mortality rate and fatality rate. These two words seem to be same, but they are completely different. Fatality rate is the proportion of deaths among people who have tested positive for the disease. On the other hand, mortality rate is a proportion of deaths within the entire population. So the population includes people who don't have the disease. According to the data from 1982, mortality rate of tetanus is 0.03 per 10 to the power of 5. This means that when we set the total population 10 to the power of 5, 0.03% died of tetanus.
Next, I will explain the treatment method. First of all, if there is a scratch, it is important to wash it well. Disinfect with metronidazole, etc. Next, use a ventilator if you have larynx or respiratory muscle spasms. Muscle spasms can also occur, so magnesium drugs can be used for treatment. It then neutralizes toxins with immunoglobulin taken from people immune to tetanus. As a characteristic of tetanus, it is necessary to vaccinate after healing because it is not immune to the disease. Finally, I'll explain prevention. Vaccination is still important, and a third vaccination is required at intervals of 3 to 8 weeks, 6 to 20 months, or 80 months later. That's all for the explanation.